Welcome you all. I am Dr. PJ Madam Duffy. Today we are going to discuss about anti-emetic drugs and emetic drugs also. Okay. So first we will discuss vomiting. Vomiting means it is expulsion of gastric contents through mouth due to mass antiperistalsis. Okay. Due to mass antiperistalsis, gastric contents are get expelled out of the stomach. Okay. That means it is vomiting. Okay. Vomiting occurs due to stimulation of vomiting center in the brain, that is lateral medullary reticular formation center. Okay. Due to stimulation of this vomiting center in the lateral medullary reticular formation, it will induce vomiting. Okay. So there are some etiological factors for causing vomiting. Those are gastric mucosal irritation, vestibular apparatus stimulation, CTG center stimulation. Okay. Due to this gastric mucosal irritation, it will produce some mediator, that is serotonin, which will stimulate vomiting center, thereby it will cause vomiting. Okay. Samely, vestibular apparatus, which will stimulate some mediators like M1 and H1 receptor. M1 will produce acetylcholine, H1 will produce histamine. These acetylcholine and histamine mediators will go and bind to the vomiting center and it will produce vomiting. Okay. Next, samely CTJ, that is chemotherapeutic triggering zone, which will stimulate dopamine, neurokinin, serotonin. These mediators will go and bind in the vomiting center, thereby it will cause vomiting. Okay. Next, coming to the types of anti-emetic drugs. Okay, in that we will have drugs for motion sickness. First is hyoscine. It is prophylaxis for motion sickness. Next is cinnarizine. Cinnarizine is an antihistaminic, anticholinergic, anti-serotonergic drug. Okay, it is used for treatment of vertigo. But drug of choice will be beta histine. Okay. Next group will be drugs for morning sickness. Drugs for morning sickness means it will be seen in mostly pregnancy patients. So what are the drugs we'll use? Doxylamine with vitamin B6, that is pyridoxine. Okay. It will be beneficial in morning sickness patients. Okay. Next is drugs for chemotherapy and radiation induced vomiting. Okay. Those are 5H3 blockers like ondansetron, granisetron, pelonosetron. Okay. Among these three, pelonosetron is most potent. Most commonly used will be ondansetron. Okay. These are drug of choice for post-operative vomiting also. Okay. Next is cisplatin induced, but these drugs will not be used for cisplatin, that is chemotherapy drug induced vomiting. For cisplatin induced vomiting, we will use aprepitant. Okay. This aprepitant is the most common drug used for cisplatin induced vomiting. This is an MCQ. Okay. This aprepitant is a neurokinin 1 receptor antagonist. Okay. Next will be other drugs used as an antiemetic, steroids, dexamethasone and steroids. Okay. Next, dronabinol. It is a cannabinoid analog used in chemotherapy patients who are not responding to the other therapies. That means who are not responding to the 5H3 agonist like the 5-step blockers like ondansetron, granisetron, and like cinnarizine drugs. Okay. So in those patients will use dronabinol, that is cannabinoid. Okay. Next is coming to the emetic drugs. Okay, emetic drugs most commonly means they will induce emetic. So they will induce vomiting, used most commonly in poisoning cases. Okay, drugs are apomorphine, ipecacuanha. Okay, these two drugs are emetic drugs. They will use in poisoning, but some poisoning cases where these drugs are contraindicated. What are those? Kerosene poisoning and corrosive poisoning, that is acid and alkali poisonings, will not use these emetic drugs. Those are contraindicated. That is kerosene poisoning and corrosive poisoning. Okay, that's all. Thank you.